Every practice manager knows the feeling. Your electronic health record, your EHR, knows exactly which patients are overdue for follow-up care. The system flags them perfectly. But somewhere between pulling that list and actually getting the patient on the phone, the outreach simply does not happen. When those calls get skipped, it is easy to blame a lack of discipline. But if you look closely at mid-size and growing practices, you will find staff working at their absolute limits. The failure to clear the recall queue is a structural lack of operational capacity. We can trace this capacity crisis directly to one metric. This diagram shows a standard front office team of 10 people. Over the course of a single year, 4 of those chairs empty out. Medical group data shows front office support staff turnover hits an astonishing 40% annually. Every time one of those seats empties, the meter starts running. Replacing a single frontline staff member costs a practice between $25,000 and $30,000 once you factor in recruiting, onboarding, and the raw loss of daily productivity. You cannot hit pause on patient outreach while you interview replacements. Every week that a recall coordinator's chair remains empty is another week that high-risk patients creep closer to lapsed appointments and unresolved care gaps. The constant churn of hiring and training traps your remaining staff in a cycle of catching up. The recall list gets pushed to tomorrow, then next week, transforming a localized staffing headache into a massive clinical liability for your entire patient panel. Even when you have a fully staffed front desk, the manual workflow itself is broken. A recall coordinator spends hours pulling a patient list, hunting for duplicates, and cross-referencing insurance eligibility before a single outgoing call is ever made. Then comes the actual outreach. For the vast majority of practices, the default communication channel remains the traditional phone call, which happens to be the least effective way to reach a modern patient. This funnel illustrates the reality of modern healthcare calling. Out of 10 outgoing call attempts, 8 are instantly rejected. Rejection rates for unknown healthcare numbers now exceed 80%, leaving you with voicemails and disconnected lines. When you rely on manual phone outreach, the results map directly to this 18 to 25% slice. That is the maximum proportion of identified care gaps that traditional manual programs manage to close each year, leaving the vast majority of your panel untouched. To achieve that low success rate, practices are still burning 15 to 25 hours of staff time every single week. You are essentially paying a near full-time salary for a workflow that produces suboptimal results. These untouched gaps move from administrative problems to clinical ones. When a patient misses a recall, they miss the medication review that ensures they are following their treatment plan, a breakdown that contributes to 125,000 deaths in the U.S. every year. For the practice, lagging in the bottom quartile of quality scores, or HEDIS benchmarks, can cost as much as $120,000 in annual revenue. By holding on to manual processes, practices are actively paying a premium in labor hours to maintain a system that statistically guarantees failure for both their patients' health and their own bottom line. Fixing this requires rethinking how the work is distributed. You have to completely separate the administrative burden of list management from the clinical duties of your in-house team. A growing number of practices are outsourcing this specific task to Staffingly. They provide dedicated remote recall specialists who operate directly inside your existing EHR. There are no new software platforms to buy and no external logins for your staff to manage. This graph tracks appointment recovery rates by communication type. While the flat line represents phone-only campaigns, the sharp 35% upward trend shows what happens when you shift to text and secure portal messages. Multi-channel outreach connects with patients where they actually look. Bringing in external specialists eliminates the usual onboarding lag. Staffingly's remote teams arrive already healthcare trained, HIPAA compliant, and ready to execute your practice's specific outreach protocols on day one. Removing the relentless pressure of recall management gives your local staff their time back. Your front desk can stop dialing disconnected numbers and finally focus their attention entirely on the patients physically standing in front of them. The human element is only half the solution. To handle the raw volume of modern patient panels, Staffingly integrates artificial intelligence to manage the invisible, heavy lifting of data sorting behind the scenes. An AI priority engine automatically analyzes and ranks your massive recall list based on clinical urgency and scheduling deadlines. This ensures that a patient with a high-risk care gap is always bumped to the front of the outreach queue. As the workflow runs, pattern recognition algorithms continuously scan for recurring administrative errors. If a specific insurance mismatch keeps happening, the system creates preventative rules automatically to stop the mistake from repeating. The system also monitors your patient volume trends to predict future staffing requirements. Capacity planning algorithms identify when your practice is about to hit a growth period, allowing the remote team to scale up before bottlenecks ever form. Pairing a dedicated team with automation allows the outreach volume to fluctuate with patient demand. The backlog stops accumulating because the system accounts for growth trends, providing a level of consistency that manual in-house programs struggle to maintain. Let's look at the financial impact of this model. This bar chart compares annual costs. On the left, a fully loaded in-house coordinator costs an average of $60,800 a year, once you include salary, benefits, and overhead. The much smaller column on the right shows the $21,600 annual cost for a dedicated remote specialist from Staffingly. That drop represents a 64% structural cost reduction, returning $39,200 of direct annual savings straight back to your practice. You are securing that massive cost reduction while simultaneously upgrading your performance. The remote AI-assisted workflow achieves 99% accuracy in recall execution, eliminating the errors that plague manual list pulling. Implementation is immediate. Practices can go live and fully integrate their exact protocols into more than 100 different EHR systems within 48 to 72 hours. To prove the model works for your specific patient panel, Staffingly offers a 30-day risk-free pilot. You can verify the exact return on investment in your own system before making any long-term commitments. Modernizing the recall workflow captures the revenue and care gaps that local teams often lack the capacity to reach. By restructuring the work, a practice can stabilize its operations and focus on delivering care, rather than managing a revolving door of administrative tasks.